How to ensure informed consent for vulnerable patients. Imagine being part of a medical study when you're not feeling your best or have trouble understanding complex information. It's a big concern, especially for vulnerable patients. When people face challenges like age, health, or social circumstances, making sure they truly understand what they're agreeing to is essential. That's where the idea of informed consent comes in. It's a process that makes sure patients know what a clinical trial involves, including the risks and benefits, before they agree to participate. But for vulnerable groups, this process needs special attention. Vulnerable patients include children, people with cognitive impairments, those who are unconscious or critically ill, elderly individuals, pregnant women, and groups facing economic hardships. These patients might find it harder to understand or make decisions on their own. So, researchers and doctors have to adapt how they communicate and get consent. First, they must give clear, simple explanations about the trial's purpose, what procedures will happen, possible risks, benefits, and any alternatives. Using easy words, pictures, or videos can help make the information easier to grasp. For patients who can't give consent themselves, like young children or people with mental impairments, consent must come from a legal guardian or authorized representative. This person makes the decision on their behalf. But even then, if the patient is able to understand, their assent or agreement should also be sought. This respects their developing or limited autonomy. In emergency situations where the patient cannot give consent and no representative is available, some trials may proceed without initial consent. This is called a waiver of consent. However, this can only happen if strict ethical and legal rules are followed. Once the patient regains capacity, they must be informed about the trial and given the chance to withdraw if they wish. Throughout the process, it's very important to document everything carefully. This includes the date, who gave consent, and what information was shared. Researchers should also regularly check if the patient still agrees to continue, especially if their condition or understanding changes. Building trust with the community from which these patients come can also help. Engaging community leaders or education programs can show that research is safe and respectful. In short, making sure vulnerable patients give informed consent involves providing straightforward information suited to their needs, involving legal guardians when necessary, seeking their agreement if possible, and always respecting their right to change their mind. Proper documentation and community engagement are also key. This careful approach protects their rights and well-being while allowing them access to potentially helpful treatments and trials.